Hi, Sam.
Hello.
Congratulations. I heard you're getting ready to discharge.
No.
Now, before you do, you have a very large surgical wound on your thigh. For best healing options, we are going to send you home with a wound vac. It's a negative pressure wound therapy to help give you secondary closure to that wound. Before we can do that, I am going to teach you how to change your own wound vac. And of course, if you have any trouble, we'll be sending you home with some home health, so they'll be able to kind of troubleshoot with you as well.
Okay.
So before we get going, I have brought in kind of a visual aid that we can work on to help with applying the wound vac. Before we get started, do you have any questions for me?
No, I might save them to the end.
Okay. Now, just to first start, how a negative pressure wound therapy, how it works for you, is it is going to remove fluids, bacteria, and debris through the suction port with the machine. It promotes blood flow and tissue regeneration, and it encourages wound closure by reducing edema and supporting granulation tissue formation, which will help close that wound. One of the benefits of the negative pressure wound therapy is that you will get to go home. A lot of times before the wound vac came out, you would have to have either home health come in and out, or you would be stuck at the hospital until we could get some closure or going to another area of rehab. But you will be able to go home with this. It is compact, and this is what it's going to look like. You will turn it on. I have already, well, we don't want all that. Sorry. When you hit the menu, I'll have to show you once we get going. It'll come up with the amount of pressure.
Okay.
We're going to start off at 125, and that's pretty standard with the wound vacs. If you're having pain with it, we're able to, you can call and we can troubleshoot, and we can reduce that pressure.
Okay.
We can go down as far as 75, but
Okay.
after that, then it's really not any benefit to you. So to begin with, we'll collect our supplies. This canister is a hinge door canister, so it's very simple to apply on these systems. You're going to look at the back, it'll hook in and close. And then most wound vac systems will have a whole kit.
Okay.
We'll be ordering these for you. They'll be shipped to your house, and you'll be able to have everything you need in one size kit. In a standard kit, you're going to have the occlusive dressing, or as we call it, the drape. You're going to have the black foam, which is going to be touching at the wound bed. And you will have the suction device that'll connect into the black foam to help remove that debris and balance the exudate from your wound. Or drainage. All right, so I am going to show you, after washing my hands, I'm going to be putting gloves on. I'm also going to be sending you home with some Vash. Vash is pretty standard of care for our wounds cleansing. Part of this is you're going to allow this to sit in your wound bed for 5 minutes. It is great at debriding and reducing microbial load, or all the little bacteria that collect in your wound bed.
Okay.
Simply you'll wet your gauze and you're going to stick it right into the wound. Give yourself 5 minutes with that sit time, and in the meanwhile you can start prepping some of your supplies. I don't know if I should really have to do it. So with your drape, and you can kind of feel it, it's kind of a 3-ply system. It's going to create an airtight system. Otherwise, if there's any leaks or bubbles, the system won't work at all, and it'll sound off an alarm and let you know about the leak. All right, and also once you're done with cleansing, you're always going to want to inspect and assess your wound base. A good wound base is going to be a dark pink to beefy red looking bed. You're going to want to look and see if there's any drainage. Most of the drainage should be red or pink.
Okay.
Also, you're going to want to look at edges. Have you noticed any scab forming? Usually we call that necrotic tissue. That tissue we don't want in the bed, and you would need to call us or the home health to help you troubleshoot that. Also, we're going to be sending and ordering you collagen. Collagen works with the wound vac system in helping build up your wound bed.
Okay.
So we always call it a wound bed matrix. And if you have a heavy exudating or heavy draining wound, you won't need to wet this.
Okay.
If you've noticed that the drainage is kind of slowed down in the canister, you'll want to wet this with the Vosh that we send you home with. When it is wet, it is activated.
Okay.
And you kind of, the way that I explain to everybody, it's kind of like fertilizer for a plant.
Okay.
That's what the collagen does. It feeds the wound bed and helps with regeneration. So you will always want to make sure you're doing your hand washing in between your glove changes. Always wear gloves whenever you're anywhere near your wound bed, just to protect that wound from getting any contaminants in it, especially after you've already cleansed it. So you'll take this, you'll place it directly into the bed. You can kind of fit it around, but you want to make sure it is in the wound bed itself and not on the outer edges. Okay. Otherwise it can just kind of dry up and irritate the wound edges. So once you have that done, we're going to start with the drape. The biggest thing with this, there's different ways to do it. Until you get it kind of down to a science, it'll take practice. But I want you just to start cutting strips. The most important thing is you want to line the wound edges in drape. You don't want the black foam to touch any part of the skin, intact skin. It can and will cause damage if it's not protected with the drape. So you see it has a 1. That's where you'll start. You're going to pull down the 1. And then you're just very careful with the edges, because otherwise it's kind of like a fly trap. You'll stick to it. And then you simply want to line all your wound edges. Once you've done that, there's another tab up top that you're going to pull. And then finally the third. And then you continue the same process. And if you notice you're running out, you can always pull this early and just trim.
Okay.
And say we've hit a crease or a hard spot that you're finding that the drape is not staying tacky or staying down. We will send you home also. I call it the lollipop. It's a skin adhesive, but it also puts a protective layer. So say you've noticed around the wound edges that you're getting a little boggy or macerated. Kind of like if you're washing dishes, how your hands soak up the water. If you're noticing that the tissue around the wound is getting a little kind of intoxicated with fluid buildup, I would use this to put a protective layer.
Okay.
It'll keep the area dry and kind of bead things off. Okay. And I can open it and show you what this looks like. And if you give me your hand, that'll be best demonstration to show you kind of the tackiness once it starts to dry. But this also will protect the edges. Unfortunately, I can't show you and use it on this because it'll break down my demo. So you keep going along. The other good thing with the drape is it's pretty user-friendly. So you can kind of set it where you want it and kind of shape it. All right, once we have the wound fully surrounded in our drape and the edges are protected, we're going to look into starting with the black foam. You're going to want to cut out a piece that is going to just overlap the edges slightly, because when it becomes depressed, when the vacuum is started, it'll suck down. So I always say this is where art comes in handy. So you just kind of go along until you find that it's just touching kind of the wound edges. As so. Now, you always want to make sure that the size of the foam is going to be big enough to cover the suction pad, because you don't want to start the negative pressure, have it suction down, and this outline hard plastic is pushed into the skin. Okay. It'll cause secondary tissue damage, and that's not what we're trying to do. So you always want to make sure you have enough black sponge to cover that.
Okay.
And you'll let you see that if you'd like. The next step is to cover the black foam in the drape. We're trying to create an airtight seal. So you simply just want every inch of the black foam. So we are almost done when we get to this stage. Once everything is covered, you're going to want to cut a hole into the black sponge. Medial is the best place, because like I said, we want this to make sure it's covered with the foam. So you can pull up, and I always tell clients to cut kind of a divot. If you fill right there, you can fill a divot cut out. Mm-hmm. And that will just help facilitate removal of any wound drainage. Oh. Then it's a sticker system in here, adhesive. And you can position this any way you want. Okay. With your leg, with the wound being on your thigh, you might want to have it run up, so it's easier to take pants on and off and you're not having to deal with it. Okay. Then there's side tab, you just push out. All right, so that is the application of the wound vac dressing. Then you're gonna take your connecting ports here, and it's male, female. You just connect it, twist, make sure that your clamps are off, and then we're gonna start therapy.
Yeah.
And you will notice the depression.
Mm-hmm.
That is how you know that it's activated,
Okay.
okay? Like I said, on the machine itself,